Billy, you this time you said you have little numbness on this hand, right?
Not a little numbness, a lot of numbness. All of a sudden one day, I just lost the feeling in that finger, and also my whole hand seemed to be weakened. It definitely weakened, so that even using a fork or a knife, I have less strength in my hand than I did. But this especially bothers me because it has this really numb feeling.
Yes.
And I'm not really able to do anything with it.
So I think there are two factors could contribute to this numbness or weakness. Very likely come from the neck. So when I press your neck area, you feel tender, right? So this time I let you lie on the left, this side, and I put a bunch of needle here, and we loosen up this muscle, then it will not press the nerves.
Right. So this is really caused from pressure on the nerve. Is that right?
Yeah. There's one thing. That's one factor. The other factor is if your circulation on the hand is not very good, it also can influence the hand. So that's why I did local needles on your hand, like this point, and this point, and then we'll also do the neck muscle, loosen up the muscle. But you're gonna do some exercise on your bed. Yeah, on your bed. I'm gonna text you a link so that you can see there are 4 movements we can do for the neck. But it's all on your bed. You can do it on your bed, on your stomach.
Well, wait, when you say you're going to text me a link, you're going to send that on Facebook or AOL?
I can send to your, I can send you an email.
Well, that's great. I'm 101. My technology is 20th century. So I really can only get AOL or Facebook. So if you'll send it on one of those media, then I can do it.
Yeah, that's wonderful. So I'm going to send a link to your email, AOL, and then you just click that link, and then there's a demonstration. It's all on your stomach. You can lie on your stomach, right?
Well, I never do, and I haven't done that since I had some massive surgery a couple of years ago. I don't lie on my stomach.
You don't lie on your stomach?
I never did really lie on my stomach. I never really liked that feeling because, first of all, it puts pressure on my back.
Okay.
Makes my back, by somehow lying on my stomach, makes my back.
Then let's do this way. If you don't like that, I'm going to show this point. You can land it in your hand. Yeah. So I just needle this point. So we're going to use this point. And if you show people where this point is, it's between ring finger and also small finger. It's just between the number 5 and number 4 metacarpal bone and in the indentation. So this point, when you're sitting there, you can press this point and then do those movements. So when you stretch this way, yeah.
And it stretches like this.
Yeah, but also you want to press here.
Press right here in this point.
Yeah.
While I'm doing this.
Yes, because by pressing this here, you are loosen up your neck muscle, and then you stretch. It will be more effective.
So you'll show me all of this when you're going to send me the link.
Yes, but not the one which on the stomach because you're worried about that. So this point, the red needles, and you press and stretch.
I press here.
Yes.
And then I stretch like this.
Yeah, you stretch. You have your neck stretch. Yes. Yeah. But
Like
then
this.
when you do this, your blood pressure may drop. So you want to close to the bed. Just when you feel a little lightheaded, you can lie down quickly.
Okay.
All right. Thank you.